This image shows the manifestations of a middle cerebral artery infarction. The MCA supplies the lateral frontal, parietal, and temporal lobes, including the lateral motor and sensory cortices, the frontal eye field, optic radiations, and the dominant hemisphere language areas. Because the MCA territory controls the face and upper limb on the motor and sensory homunculus, an MCA stroke causes contralateral face and arm weakness and sensory loss more than the leg. The striped yellow area on the patient's right side represents a left MCA stroke causing right-sided deficits. Involvement of the frontal eye field causes the eyes to deviate toward the side of the lesion, so a left MCA stroke produces leftward gaze deviation. Damage to the optic radiations leads to contralateral homonymous hemianopsia. Here, a right visual field loss from a left MCA infarct. If the dominant hemisphere is involved, language areas are affected. Broca area produces expressive aphasia, Wernicke produces receptive aphasia, and arcuate fasciculus damage causes conduction aphasia. Any combination can occur depending on lesion extent. The image shows difficulty producing the word grapes as an example of aphasia. Primary motor and sensory involvement in the lateral cortex explains the prominent face and arm deficits. Leg involvement is less pronounced compared with an ACA stroke. In summary, contralateral face and arm weakness and sensory loss, gaze deviation toward the lesion, contralateral homonymous hemianopsia, and dominant hemisphere aphasia when the left MCA is affected.